Hello, everyone. You are live with Jonathan Maness, aka the One Leg Bandit, CEO of Maness Veteran Medical. And today we're having an excellent talk with one of my outstanding partners, Comfort Release Bandages, also known as Global Biomedical Technologies. Special thanks to Dr. Howard Rosing and team for being a part of this. And we got Denise Anderson and Susan Taverna here as well. But we're going to go over a bunch of different things today about the Comfort Release Bandages. But everybody has been in a situation where you've had a bandage on your arm or Band-Aid and you rip it off and it either rips a lot of hair, but for elderly patients, veterans, people with aging skin, it can really become a problem. We're going to go over some of the problems that can arise from that today. You're going to learn a lot, learn a lot about comfort release, and again, learn about how Maness Veteran Medical is innovating and bringing these great products to the VA so the veterans have access to the best products that are out there. So please enjoy this quick video. This one's about 3 minutes, but just enjoy it, watch it. It's very informational, and we'll be back all together.
So my idea for a smart, switchable, and pain-free adhesive started about 8 years ago, after I had sold my medical practice. Looking back at the time, a family member, a close family member, was being treated for chemotherapy for cancer. I'm happy to report that their battle was a successful one, as they are cancer-free today. Yet looking back at the time, one of the biggest hurdles they had to overcome actually came just as they were ending their cancer treatment. They experienced a severe skin tear as a nurse was removing an IV securement device. The skin tear turned into an infected wound, and that infected wound required an extended hospital stay for 4 weeks. I knew that this complication was unnecessary. I knew from my own medical practice that many patients suffered from skin injuries, from medical dressing removal, and my own children actually hated the discomfort of simply removing common adhesive bandages or tapes. And most of those Band-Aids didn't stay on as long as we needed them to. We needed to invent a smart adhesive dressing that goes on when you need it to, it has optimal adhesion, yet can be removed on command with no pain, no trauma, no residue, and no skin tear. And particularly when a patient's ready to go home or in a hospital. I've later learned that an estimated 1.5 to 4.5 million documented skin tears related to removal of bandages, tapes, and dressings occur every year in the United States. I also learned that nurses sometimes take 15 minutes to gently remove a bandage or a dressing from a patient because of the associated pain or potential injury that it causes. It seems like most medical bandage companies simply do not care. With my engineering background, I was able to work on the development with a young Dr. Professor Wang in the Biomedical Engineering Department at Georgia Tech. Together, Dr. Wang and I developed the world's first smart, switchable adhesive for bandages, tapes, and dressings, backed by multiple patents. The secret sauce that we created is an adhesive made of a polymer that functions almost like a light switch. When it is on, it provides optimal adhesion combined with highly breathable properties, leading to greater comfort, extended wear time for patients both in a hospital and at home. The breathable dressings benefit from high measured moisture vapor transmission rate value, an MVTR. This is a measurement of breathability, and it's unsurpassed by any other product on the market. But when it's time for removal, the polymer can be turned off. The adhesive bond drops off with a small swipe of rubbing alcohol or isopropyl alcohol around the border of the dressing, around the border of the bandage or tape. Today, we're ready to improve the standard of care to protect sensitive skin with our branded Comfort Release portfolio of smart, pain-free adhesive products, which are ideal for geriatric, pediatric, and any other patient with thin skin, such as someone on blood thinners, steroids, or other medications. We can now avert medical adverse events like skin injuries and skin tears, and that's why we came up with the concept of a smart, switchable coverage used in products such as bandages, tapes and dressings, and securement products for wound prevention and management. And we're proud to say today that we're able to do just that.
Okay, we are back, and we have Miss Denise Anderson and Sue Taverna here with us from Comfort Release, and we're going to go over a couple things today. But again, thank you so much for your time, for being here with us, and letting the world know about this outstanding product, Comfort Release. So, Miss Denise, if you would go ahead and get started, tell us a little bit about yourself.
Hi, I have been a wound care nurse for over 20 years. I've worked with a corporation. I've worked inpatient nursing, outpatient nursing. I'm wound care certified, and have always been interested in wound and wound healing. And so happy to be brought onto this team for Comfort Release and give this next generation innovative product to people that really need it.
We appreciate you. Sue, go ahead and tell us about yourself.
Sure. Thanks, Jonathan. Yep. Well, I've been in sales for medical device for a number of years, and I've worked in surgical smoke evacuation in the past. And this product just really interested me, something to be passionate about because there's a need for it in patients out there with thin skin. And so I'm glad to be a part. I've been here for about a year now.
Well, you know, the excitement that I get every day by getting to talk and bring these outstanding products, the way that we're all available and the way we come together to get the word out on these products is just outstanding. But we're going to dig into a lot of the specifics of this bandage today, you know, what separates it, what makes it outstanding. And we just got so much information to go over. But Sue, Denise, let's start with you. Tell me a little bit about the development of this product. How did it all come together? And, you know, how did we all get here to this point today?
Well, I think it's just kind of interesting that the physician that created this bandage was not a wound care doctor, but a neurologist, Dr. Howard Rosing. And it was because, like we saw in the video, the personal incident that he had with his family member and how traumatic it was and how it almost cost this person their life. Can you imagine going through cancer and chemotherapy and surviving that and almost having a tape injury take your life? That's pretty severe. So it really was something that made him think long and hard about how this problem can be solved. And that's when he came up with that. And Sue can tell you more about the workings.
Yeah, what you got, Sue?
Sure. So as he had mentioned in the video, he worked with a biomedical engineer, and they came up with this first switchable adhesive. And it's really amazing that just about a year and a half ago, you know, their one product was a bandage. And, you know, from there, it has just expanded, and, you know, we've been adding. So, you know, now we've got the transparent dressings and foam dressings along with the tape, and all with that same switchable adhesive technology. And, you know, we do so many of these virtual meetings now just because we can't be in person at the facilities. And it's really wonderful just to see that aha moment when a nurse or a provider goes through, and we do something called Take the Comfort Release Challenge, where they can try it right next to one of the products that they currently use. And when they see, you know, just with a swipe of an alcohol pad, how it just releases the polymers on the adhesive and it just lifts right up. And it's just something that, you know, is not out there now and is such a need for it. And then, you know, you have them right there, but then once you see that alcohol evaporates and they can kind of, you know, they've lifted up, looked at the wound, and then they can lay it right back down. So we call that the lift and look. And so, you know, we've, like I said, just come from the one bandage to our full product line, and it's still growing. We're coming out very shortly with a larger sacral foam dressing and a larger transparent dressing, along with some IV kits too.
Yeah, constantly evolving. You know, this comfort release technology is really going to get where, if it's anything from a little dot bandage to whatever needs whatever application is needed. I believe Comfort Release is going to make sure that we address that. So Denise, tell me a little bit about the medical adhesive related skin injury, the MARSI. What is that? So the people that are watching today can actually learn a little bit about, what it is and how much it really affects, especially the veteran group, but anybody in this industry.
Absolutely. So MARSI is a relatively new term for skin injuries, but nurses have seen this forever. So there's all kinds of tape-related injuries. Now they have an acronym for it: medical adhesive related skin injury. That's how you get the acronym MARSI. But it really occurs when the adhesion to skin bond is stronger than the cell to cell bond. So when you go to pull that dressing off, you can even see the skin lifting when you're trying to pull that adhesive off. And it really does injure the skin, both underneath the layer of skin and on top of the layer of skin, because you're separating those layers of the epidermis. And it can cause bad skin tears, folliculitis. There's all kinds of dermatitis that happens from that. And even maceration, which is basically when it gets too wet under the bandage, that causes all kinds of injury to the skin. And if you're talking about, a veteran, there's a lot of veterans that have maybe chronic wound issues, might be diabetic, or have problems with arterial flow to the lower extremities. And these little skin injuries from tape can end up becoming big injuries that I've seen even go into amputation.
And how long does that take? It doesn't take too long, does it, Denise? You get a skin injury like that, it can go from something small to big in a matter of weeks, even quicker than that, right?
Yeah. We've even seen it in a week go downhill really quickly. So very scary. So we don't want that for our veterans. We don't want that for our population. But as the skin ages, it has less and less ability to bounce back from injuries like that. And this MARSI injury is something that really needs to be addressed. And this is the only product that really addresses that injury in this way.
Well, thank you, Dr. Wang and Dr. Howard Rosen, for coming up with this. I mean, anytime that something, it seems like with a lot of my partners that I speak with, anytime that something directly affects them, they get a passion and a drive, and they start from the very beginning and they follow it all the way through. And that's why Maness Veteran Medical is always looking for those types of partners, because if the passion and drive is there, you put your whole heart into something, that it's going to work, and that's what really matters. Sue, if you would tell everybody that's watching today, where can they go to sign up for the challenge? Because I know when I took the challenge, absolutely mind blown. This is a mind blown type of cast right here. I want everybody to know that, but I want anybody who wants to experience that to listen to Sue here and let her tell you where to go to take that challenge.
Sure. Well, you can contact us via our website. I think there is a page on our website where you can just click to fill in for that to get the samples, and we'll contact you from there. And we can set that up, whether we have a rep in person or do it virtually. Either way, you can do that. So our website is just comfortrelease.com. And we would love to do that. We just did one this morning. And again, it was a nurse at a large facility that really went to all the floors for the different wounds, but saw a real need in their oncology and transplant patients. So
beautiful. And any VA out there, I know a lot of procurement officers are here on LinkedIn Live with me. Any VA that wants to try this, you reach out to Maness Veteran Medical. We will help you get this set up. We'll get you the samples that you need. Maness Veteran Medical is all about the support, making sure that you get to try it. Once you try it, I know that you're going to want it. We'll handle all that, as far as getting the product to wherever you're at, whatever door you need it at, we'll make sure it gets there. Okay, so let's dig a little deeper here. Tell me, I know we briefly hit it, but tell me a little bit more about the specifics of the different types of products that you have. And then Denise, I know you have a sample product. Please show us what you got, if you don't mind.
Okay, Sue, did you want to talk about the products first? Or?
Sure. So, I kind of touched on it lightly, but, we started out with the bandages. So we have the smaller 1x3 and the larger 2x4 bandage. And then our transparent dressings are a smaller and a medium. I think they're 2x2 and 3x5, somewhere close to that. And we are, like I said, coming out with a larger one as well. And then our foam border dressings are 4¼ by 4¼ and our products are all water resistant or waterproof. So that's another big advantage. You know, you can shower and swim in them, and you're going to be able to keep wearing them. I know one of our other clinicals that lives in Florida mentioned that she tested these like crazy, you know, before coming on with our company, and she went to the beach and, you know, biked along the way and worked up a good sweat, and they didn't budge. So, you know, some great products. And then, of course, our tapes as well. And those are in a 1-inch and a 2-inch tape. So.
And some of our newer products that we just joined with our great adhesive is the BioPad, which is a collagen. It's a really superior collagen. It has a much more distinctive matrix for growing of tissue and is a superior collagen product. And then we have some Manuka honey products as well. These are also brand new. Trying to get them in there so you can see it, but they these are superior quality of Meta honey products that Manuka honey products that actually work better with causing that not to have that growth of new tissue in there and to prevent bioburden from building up. So yeah, some really great products I'm excited about.
Yeah.
Beautiful. And Sue, go ahead. Any more you want to add there?
No, I was just going to say those are sold along with our transparent dressings because they are, you know, it's secondary dressing. They just work wonderfully together.
Yep.
Beautiful. And again, everyone, reach out to Denise or Sue or myself, and we will get you whatever samples you need. Now, Denise, if you would, let's go ahead. I'm going to try to get a better, hold on one second. There you go. So I'm going to get you load up there. So, okay. Right there. So tell us about the dressing.
So this is our transparent dressing. What's unique about this dressing, first thing you notice when you put it on, it is softer, it is more comfortable. It has that moisture vapor transmission rate very high, so it doesn't get too moist under the dressing and cause that maceration as we talked about earlier. But it doesn't allow moisture to get in. So you can shower, you can bathe, you can go to the beach, and it's not going to get wet. So you have that great adhesion, you have that soft feel, it feels comfortable on the skin. And then you take the alcohol pad, which you can get these dressings with or without the alcohol coming with it. And what you do is you just swipe the outside of the dressing, make sure I get it on here on camera, so you can see that it turns translucent color. And that's when you know that you've broken the bond of the adhesion. And of course, in COVID world, it never hurts to you know, sanitize the outside of a bandage, does it?
No, definitely not. But
See,
everybody looking here, look how you can see the bandage is completely wet. And once that happens, let them know how it goes, Denise.
okay, so once you do that and you can see that translucent, you see the difference in the color, you can go ahead and peel that right up. Trying to keep it in the camera. And it is so comfortable coming off. It almost feels like a tickle. There is no pain at all involved, no pulling of the skin, no pulling of the hair. It feels really good. And then as soon as this alcohol dries, you can go ahead and put this bandage right back down and it readheres. So it's a great lift and look technology. If you're in the hospital and the doctor wants to come by and see, you can look up and see what's under the dressing. You can change out the primary dressing if you want, and then put that secondary dressing right back down, and you have a perfect adherence again.
Beautiful. I mean, what an amazing, everybody. This is what I'm talking about. Cutting edge right there to the VA. So Denise, thank you for that demonstration. Now, just out of my curiosity, for like cancer patients, people that have to have ports and things of that matter, is there something there that helps with that? What type of products do you have? Because I know, even just getting IV into your arm, it gets aggravating sometimes. A lot of people have to have it hours a day. Do you have anything that would fit that product?
Yeah, so this product is, some hospitals are using this right now, or using this for over IVs.
Mm-hmm.
This transparent dressing. We have two sizes, but we are coming soon. We're having IV and central line kits that will have all the kits available with everything together with our patented comfort release transparent dressings right in the kit. So we can't wait to have that in the hospitals. We know it's going to be a game changer really for people, and it comes full circle because remember, this is where Dr. Rosing's family had the problem to begin with. It was a PICC line dressing. It was a tegaderm dressing, and that's what causes huge injury. So how wonderful it's going to be to have that excuse me, full circle, and be able to use that product in that way.
Beautiful. Now, Sue, let's talk a little bit about this. The VA, we're all about getting the best product for saving as much money as we can. Let's talk about the expense, the cost of the actual dressings. Where do we fall in there, and what are we looking at?
Well, to start off, you guys were talking about MARSI, medical adhesive related skin injury, and it was estimated that there's about 1.5 million cases of that per year, which is probably a very, underestimate because a lot of times those aren't even reported. But what I'm getting to is that an average cost of MARSI is $98. So this prevents that in the first place. So just think, besides of all the pain, the cost savings right there, multiply that times 1.5 million or 2 million. So that's a cost savings right there. Our dressings are probably about 1/3 of a cost of silicone products. So, if you think, oh, this technology is so wonderful, but what's it going to cost? It's really not. It could be less. And then besides that, we talked about decreased MARSI. Also, you're going to have less products to use or less SKUs in your facility because you're not going to have to use as many products. You're not going to need skin protective products, skin adhesive products, anything like that. So, you can pare down on the amount of products you're using. And then you're going to couple that with decreased staff time. So, you talked about nurses sometimes spending 15 minutes or more trying to remove a product. And, that's going to cut right down because all you have to do is swipe our adhesive and it will come, right off. So it could be a definite savings for your facility.
Absolutely. Lots of huge advantages here. And, the VAs are always looking for that. You may not know that, they have huge budgets, but they're always trying to save that budget because you never know what they're trying to do. But all those things that you just brought up, Sue, every single one of them is excellent cost savings. I mean, you get everything in one bandage here. You don't have a ton of things that you have to bring in from the supply shelf to make one patient okay or good to go. So we have definitely hit a lot of good points here. What I want to do.
Can I add one more thing too? I was just thinking, working with wounds for so many years, a lot of times you have to wrap if it's on the leg, you got to wrap it with Curlex, wrap it with Coban to try to keep the dressing in place, to try to avoid putting tape on the skin. And what happens is you have that big bulky dressing, what ends up falling down anyway. With this, you can put it right on the skin. You don't have to worry about wrapping it up and it falling down, and you don't have to use those extra products as well.
Yeah, that is so completely aggravating, and what a true point that is. So what I want to do, I want to share one other small video with you, everybody that's watching today, just so you can see how to partially, we kind of just showed it in the demo, but I want you to see it on the video side of things because it's very clear and concise, and I want you to see it with your own eyes. So watch this quick 1 and 20-second video, and then we'll be right back with you.
I'm now going to demonstrate how you can check a wound. So if you have a patient with a wound, you can remove this dressing partially to check the wound and then reapply the dressing after you have visualized the wound. You use your alcohol to wipe down the border of the transparent film till it has changed color to translucent. You gently peel back. You can visualize your wound, and if you do not need to change your primary dressing because the dressing is not saturated, you can gently lay it down, and when the alcohol evaporates from the border, your dressing will seal again. So it is replaceable, removable, and adjustable. The dressing is waterproof, so the patient could take a shower or take a bath with this dressing on, and the wound would not be disturbed.
So Denise and Sue, this has been a great stream. We've let everybody know about the product, and I am so thankful that y'all spent some time with us today. But I want you to give, some remarks, some goodbye remarks, and any last things that you'd like to go over here before we sign off.
Well, I would like to say that the feedback that I'm getting from the patients that have used this product is phenomenal. I've had some that I've contacted that have bought it online and some through wound centers. And what they're saying is it's the best bandage they've ever used. It's so comfortable. It's pain-free. You think about, too, in hospital use, hospitals and nursing homes are not getting reimbursed for wounds they cause themselves anymore. CMS is not reimbursing for that. So it's so important to prevent these injuries for cost savings and for patient satisfaction.
Beautiful. And Sue, what you got?
Yeah. Well, I want to thank you again for having us, and just, it's just exciting to see these new products come out, and really wonderful to see when it solves someone's problems. We got a mom that contacted us, and she found us either on Facebook or Amazon, but she has a baby who had an NG tube, and the tape was just tearing up the baby's face. And she got a hold of some comfort release, and it's been, a game changer for that family. And, what a good feeling that is. So it helps a lot of people.
Well, we really appreciate you being here on the live stream today. So I hope y'all have a wonderful day. I'm going to finish up the stream here, but thank you very much for your time.
Thank you, John,
for having us.
So everyone, what a great stream. Look, when it comes down to what I like to say, where the rubber meets the road, working with great people like that and bringing these wonderful products out to the VA and to the entire world is what is my mission right now. I'm here for all the small businesses out there, and I'm here for my partners at Maness Veteran Medical so we can all grow and move in the right direction. But I really appreciate your time. This weekend, I may do a stream. I don't really know yet, but it's going to be about small businesses this weekend. Next week, I've got some other good product videos coming out. Not videos, but live streams. If you would, please, I'm putting out great content so everybody can learn together. Please go to my YouTube at Jonathan Maness and subscribe to me on YouTube and follow me on LinkedIn here. It really means a lot if you hit the like button and comment with me and help me grow, because it's not just about me growing. I really believe that my message and my knowledge is going to help so many other people grow and make money together. So I appreciate y'all. Love you to death. And the One Leg Bandit is out. I'll talk to you next week.